I'm Dr. Kenneth Mook. I'm the medical director here at Vibra Healthcare, Gateway Rehab in Florence. We're an acute rehab facility, and the difference between an acute rehab facility and the skilled nursing facilities are that we are all CARF accredited. All the Vibra hospitals for acute rehab are certified acute rehab facilities. The goals of inpatient rehab are to get the patients back to a functional level where they can return to home. The therapies that we typically do are kind of four different things. One is physical therapy. The other groups are occupational therapy, speech therapy. In addition to going through your regular therapies, you also have respiratory therapy working with you. And then we have psychologists as well that work with depression, anxiety. We have 24-hour nursing that is specifically related to inpatient rehab. We also have therapists here who are specifically trained and want to do inpatient rehabilitation rather than outpatient therapies. So it takes a kind of a special heart from the therapist to have that gift to work with patients who are kind of at their lowest functionally and try to get them back to a level where they can go home. We have the technology in our buildings to do all these therapies. We have multiple pieces of equipment that are specified for different diagnoses. Sometimes skilled doesn't have that technology that we have. The difference also between acute rehab and skilled nursing facilities is the timing of how much therapy you get. In the inpatient rehab, you do 3 hours a day or 15 hours per week. At the skilled unit, you make it 1 to 2 hours per day, and sometimes they only do therapies Monday through Fridays. We do therapies basically every day of the week. We look at the whole picture of the patient. We're not just looking at heart, lungs, bowel, bladder. I mean, we're taking everything into account as to what this patient needs in order to get home. So by having that, it's a little different than the acute hospital where you may have certain specialists who are only looking at one organ system, but from a physical medicine and rehab standpoint, we look at the whole body. And so we provide quality of care to get you back to home from a mobility standpoint, medically stable, and we also are teaching you what you need to do on a daily basis to prevent yourself from going back into the acute care hospital. So that education part is a big portion of inpatient rehabilitation.